and probably 1,200 of them would give you a problem, 1,200 would give me a problem, but they're not the same 1,200. So if we do the compatibility test, then you find out which material can be placed that does not that challenges your immune system minimally. I mean, there's nothing that's perfectly safe, but a 5% challenge is a whole lot better than a 95% challenge.
The devil really is in the details, isn't it?
Yes. If you leave something out, leave out one little portion, there are a whole lot of things involved with taking out amalgam. You know, we developed a protocol over the years, and you leave out one of those steps, you might as well have not done the procedure. I mean, there are a lot of people who call themselves biological dentists, which means I'll take your fillings out for a price and not give you a guilt trip. But you ask them to look at, you know, what we just talked about with you earlier, look at the CBC, the red cells and the white cells, say, look at the CBC, and I had one of them tell me one time, well, how do you spell that? Well, if they don't know how to spell CBC, they certainly don't know how to interpret challenges to the immune system.
You know, Dr. Huggins, 99% of the dentists out there are not whole systems dentists. You're talking about whole systems dentistry. Dentistry as it relates and communicates with the whole body, right?
Right.
Yeah. So talk to us about the fact that in a root canal, you're trying to basically save the tooth. Can you go back to why that isn't effective or what your issue is with root canals?
Well, the issue with the root canal is it's dead. Now, the Dental Association argues with me on that. They say they're not dead, they're non-vital. Well, if you look up in the dictionary the term non-vital, the definition is dead. But the whole thing boils down to liability, because no other part of health professions puts dead things in the body. And the body has a surveillance system within the immune system, and it checks all your cells every day, 3 times a day. And it looks for a code. There is a code, a 5-digit code on your cells. And you don't find that on a root canal tooth because it is dead. So it starts an autoimmune response. Autoimmune means auto is self. Well, what happens is you get dead things on this tooth, and the immune system looks at it and says, this is not self. This is non-self. The same thing happens with mercury. You put mercury, a atom of mercury, on a nerve cell, it is non-self. So the immune system attacks it. Well, it's attacking a nerve cell, and that's why they call it autoimmune. The immune is attacking self. It is attacking what is registered as non-self, but then we call it multiple sclerosis, Lou Gehrig's disease, seizures, and tremors, and things like that, and kill the immune system. Well, that's like, hey, we can stop the war in Iraq in one day, kill all the American soldiers, and the war would be over. That's what we're doing here. The immune system is our soldiers. Don't kill them off. You know, I spent 4 years taking immunology, and I love those little white blood cells. And I don't want somebody killing them off because that's all we have to keep us alive.
So it sounds like it's a question of reducing the amount of bacteria, not getting ultimately rid of bacteria because it's not going to happen. What exactly are you looking for?
Well, what I'm looking for, yes, reduce the amount of bacteria. But there are a whole lot of things that we have not even touched on.
I have time and I've made time. Whatever you want to do, I'm here.
All right. Well, this is another thing that relates to this. What you eat determines whether you're going to get tooth decay or not, and it has nothing to do with touching the tooth. Ralph Steinman out there in Loma Linda published 70-some papers on this, where what does sugar do? That gives you decay. So he took rats which have the same type of process in forming dental decay that humans do, and he fed them a 62% sugar diet, which is like candy bars. And they developed X number of cavities. Then he took the same amount of sugar and put it through a stomach tube so it did not go through the mouth. He got the same number of cavities in the rats. Then he took it and injected it just into the body cavity, not even into the stomach, just squirted it into the body cavity by injection. Same number of cavities in the mouth. So there's no way it comes anywhere near touching a tooth. But what he found was that there is a protective fluid flow that goes from the pulp chamber, when it has a nerve, through the dentin, through the enamel, into the mouth, and this prevents bacteria from coming into the tooth, creating decay. But if you are eating the foods you should not eat, then this fluid flow turns around and becomes a suction, and it's pulling bacteria from the mouth into the enamel, into the dentin, into the pulp chamber, which can give you root canal problems, can kill the tooth, or it can give you decay.
I have a quick question here. How do you know that that paper that he wrote about fluid flow is not just a theory? How do you know it's a fact?
Because he wrote 74 of those papers at the University of Loma Linda over a period of 15 years, and he used radioactive acroflavin hydrochloride to trace the fluid flow, and found that it was under the control of the parotid hormone produced by the parotid gland in the cheeks. You didn't think I knew the answer to that, did you?
Actually, I thought you would know the answer. I didn't realize it was so heavy. See, for the audience, I want them to know the level of what you know. I want them to have a flavor for this.
Okay. Well, there was another fellow, Dr. Melvin Page, who got me started in blood chemistry. He was on the other side of the world, over in Florida, and he was doing blood chemistries, and he found when the blood phosphorus level that we talked about with you a while ago drops below 3.5 milligrams, that you have decay. If it's above 3.5, you don't have decay. Well, what he was seeing was another way of determining which way the fluid flow is going without using radioactive materials. And we have found through the 42 years of my experience the same thing. People have a low phosphorus, they got a lot of decay. If the phosphorus level comes up, they don't have a problem with decay. But if it keeps going up, then they have inflammatory conditions, like certain people we talked about earlier with a phosphorus of 4.5. Then there is inflammation. Is it in the gums? Is it in the joints? Is it in a tooth? This is where the professional has to come in and determine where is this inflammatory condition coming from. But the blood chemistry tells the story.
How fascinating.
Well, it is. I'm glad to hear you use that word. I've worked in it for over 4 decades, and I still find it fascinating every day.
Why are they giving children, teenagers, root canals? I don't get that.
Don't tempt me.
I'm tempting you because my girlfriend's son, who's 17 years old, just got 3 root canals in Montana, and I just about flipped.
Okay, you want to get into this in depth?
I want to get into it in depth, and what I want to front load you with is the following. I know that kids live on massive amounts of sugar, so I would understand why their teeth are a mess, why they're seeing many more diseases, okay?
Yeah.
Between not flossing, using the wrong kind of toothpaste, not being hydrated enough, living on Coke and bad drinks and food, I could get that on a nutrition level, okay? But why the doctors are so quickly giving them root canals at such a young age when their immune system isn't even strong enough after what you've been saying to sustain it, I don't get it.
You ever heard the word quota?
It's really hard for me to fathom that.
It is for me, too, because as I understand it, in 1990, the Dental Association set a quota of 30 million root canals a year by the year 2000, which they accomplished by the year 1999.
How are they able to set a quota? Why would they do that? No, really, why would they do that? Isn't that a conflict of interest?
It's called preventive dentistry, which sounds very religious.
Okay.
Okay. Anyway, they reached that, so I have heard that now the quota has been increased. But I see this in the patients I talk to, like one I talked to just a few days ago, where I think it was the hygienist or the assistant said, we're going to schedule you for a root canal. Well, had the doctor even looked at your x-ray when the hygienist said you need a root canal?
First of all, it was a new doctor, and my doctor had sold his practice without me knowing. So when I went in to get my teeth cleaned, and the hygienist saw that my front tooth was pink in the back, and the doctor came in, and he'd only been practicing dentistry for 5 years, was already talking me into a root canal. But what was weird is my tooth is totally vital, and he couldn't figure out why my tooth is vital. He